friends! Welcome back to Cygoth. My name is Courtney, and oh yes, we're doing it. It's almost a rite of passage for any YouTuber to do one of these iceberg videos. However, I haven't seen an iceberg video on the strangest medical conditions, and being that I've been in the health field since I was 14, oh god, that was so long ago. Being that I've been in the health field since I was 14, this kind of called to me. This iceberg comes to us from the Reddit user u/daregmaze. And the fucking psycho decided we're gonna have 77 entries. Now don't worry, I'm not going to be showing any medical gore because I'm sure that YouTube will strike me down a small, tiny 20 sub channel for daring to show any educational content. So to represent some of the medical gore, I've included some illustrations that I found online. However, they can be a little bit confronting, so please take care of yourselves. If you do like medical stuff, hit like and subscribe down below to see some more. Lysovirus rabies is a zoonotic viral infection with a mortality rate of these close to 100%, as reported by all the sources that I looked up. But there is one pretty prevalent survivor with a BAMF immune system, Gianna Geese, who had no symptoms until a month after contracting it and barely survived after receiving 2 months of intensive care. So rabies is found all throughout the US and in other developing countries. The only places that don't have it are islands, Great Britain and Australia. Hey, Australia. We may have Pauline Hansen, but at least we don't have rabies. Rabies can be caught by any mammal, such as dogs, wild carnivores, and bats. We all know that bats are a great reservoir for zoonotic diseases, don't we? The virus enters mostly from bites and following that saliva of infected animals, but can also be from contact with open wounds like animals licking it and inhalation of viral particles. The virus spreads from the tingling contact site to the brain and spinal cord by traveling along nerves and muscle fibers. This diagram shows just how quickly the virus can travel, given how many nerves and muscles we have in any given area. The virus then decides it's had its fun at the central nervous system and spreads away to the outer nerves, especially to the salivary glands. So the salivary glands are very highly innervated, and we have 2 sets on either side of our head. So we have 3 sets of Hochtua glands. So this is how we develop the hypersalivation and the hydrophobia associated with rabies. Not to be confused with homophobia, although that would be just as bizarre. There are 3 phases in the progression of rabies: the prodromal or beginning phase, which shows a lot of the same symptoms as, say, a chest infection or a tummy infection, but that's where it often gets ignored. The second phase is the neurological phase, categorized as either furious or paralytic. The main difference between the two are one goes nuts, which is your classic rabies, or they lose control of their body. The third, inevitably, is slipping into a coma and dying. RIP. According to my research, there is no cure. There are only preventative vaccines, post-exposure vaccines, and rabies immunoglobulins. Rabies immunoglobulins are immunoglobulins that have been trained to fight the rabies virus. So when you get a vaccine of the rabies immunoglobulins, what they do is they fight the infection while your own immune system is developing that memory of how to tackle it. Now, before you come for me, I know it's called Hansen's disease, but I'm going to be saying a lot of words, and I would like to condense the amount of words that I'm gonna say. We hear about leprosy as being a medieval disease. Mate, thine face art falling off, thou art a sinner in it. Fun fact, it is not caused by sin, but rather by different bacteria, such as Mycobacterium leprae, which is the most common one, and Mycobacterium lepromatosis. In 2005, the World Health Organization reported that leprosy had been eliminated. However, Diana Lockwood et al. Called bullshit and reported that leprosy was still a threat, which has been backed up in 2021. The disturbing thing is that the bacteria can linger in your system for up to 10 years before you show symptoms. The most common mode of transmission is the inhalation of bacteria. El Macaque offers more specific routes of transmission, such as tattooing, household contact, and armadillos. And I'm sure we can all agree that Being tattooed at home by an armadillo is a bad idea to start with. Maybe that's why it's still prevalent. Alamu Bellici and Bernard Naffs characterized leprosy as a disease of the peripheral nerves, skin, and upper respiratory tract. There's several different types of leprosy, depending on the person's immune system, extent of neurological damage, and how the lumps and bumps on the skin look. Normally I would go through the diagnosis, but it's just way too technical for this video. There is a preventative vaccine called BCG, and for those that are symptomatic, there are very lengthy courses of antibiotics. Conjoined twins, as defined by Abbas Bindlish and Anupama Sawal in 2022, are two babies that have fused together at some point during embryonic development. The most well-known case is the case of Chang and Eng Bunker, born in 1811 in Thailand, or Siam as it was known back then, giving rise to the moniker Siamese twins. The most common varieties encountered, as reported by M.F. Kaufman in 2004, were Thalassoamphilopagus, Amphilopagus, and Craniopagus. They may either have completely separate functional organs, or they might have to share organs.
You hear that, Meredith? You only have to share your Barbie dolls with your sister, not your liver. Stop complaining!
But how does this even happen? Asma Mian et al. In 2017 offered two of the more accepted theories, fission and fusion. But first, we're gonna have to speedrun embryology. Here we go! So, the ovum gets fertilized, implants into the lining of the biological female's uterus, and it begins to divide like normal cells, but kind of within the cell. The clump of cells, now called a blastocyst, forms three layers inside that you can't see here because I couldn't find a diagram that wasn't overly technical. Alright, so back to the theories. We have the fission theory, where there is an incomplete splitting of the embryonic layers during early development. And there's the fusion theory, where two embryos fuse together, and the site at which they fuse dictates how the twins are going to present when they're born. Also, I'm really sorry. I tried to make that as simple as possible, but embryology is one of the most complicated sciences out there. But if you're knowledgeable on embryology, hand my ass to me in the comments below. Separating conjoined twins has become easier with medical technology advancements. However, this is all dependent on whether they share any organs, which organs they do share, and how many organs are being shared. Even to this day, incidences where brains and hearts are being shared makes it nigh on impossible to separate them without causing brain death. In 2024, Yu Hashao et al. Studied the effectiveness of detecting conjoined twins during prenatal ultrasounding. 20 cases of conjoined twins were assessed at different gestational ages, that is, how old the fetus is in utero. They concluded that ultrasounding is a key tool not only in identifying the morphology of the conjoined twins, but picking up any other birth defects. Where do I even start with this one? Everybody knows what cancer is, but do you know how it's formed? I did promise in my last video that I might make a more in-depth video about cancer, so here we go. Globally, 1 in 6 people will die from cancer. As reported by the AIWH in 2025, 169,000 Australians were diagnosed with cancer in 2024. So this is an increase of 93% over the last 24 years. However, on the bright side, there is a 71% increase in the 5-year survival rate. Let's look at this pic and break it down. Normal cell dividing happily, when suddenly
oh shit.
there's a mutation in the gene that says, okay, have a rest now, please. This makes the cell divide uncontrollably, creating more and more crazy cells just going nuts. This can happen to literally any cell in your body. Benign tumours, like warts, tend to stay in their lane and grow really slowly. They have a fibrin cap around the growth to keep it all together. Malignant tumours, however, are cell masses on crack and give no shit where it goes. Eventually, the cells in the middle will start dying from lack of oxygen and nutrients. Case closed, right?
Nope.
The tumour cells will start releasing chemicals to order the cells around it to become blood vessels so they can keep growing. And because there's now blood vessels right next to these really dangerous cells, they can very easily yeet themselves into the bloodstream and make like the English. colonize wherever it lands. Fun fact, the tissue where the tumour originally grew will start to grow on the new area. For example, if you had breast cancer and it metastasized to the liver, the tumour will grow breast cells on the liver. Nothing like the motherland, hey England, I mean tumour. I'm allowed to say this. I'm both English and Australian. My ancestors both victimised the Aussies and were victimised by the English. Alright, getting back on track. How does this happen? There's quite a few ways actually. There are exposure to carcinogens such as cigarette smoke, exposure to radiation including UV, which is why we get a lot of sunny places in the world with high rates of melanoma, high levels of tumour promoting hormones such as estrogen, and DNA mutations in the cancer preventing genes and in the tumour promoting genes. Treatments for cancer include the traditional chemotherapy, radiation, with or without surgery. However, a paper published by Dabala et al. In 2021 talks about some new advancements in oncology, including stem cell therapy to regenerate damaged tissue, targeted therapy which has the potential to stop tumours in their tracks, and ablation therapy to freeze and or burn off tumours. There are heaps more that are discussed in the paper, but we'd be here all day and we still have 8 topics to go. By the time this ends, I'll have withered away and died. This is part 1! It's a poor sort of memory that only works backwards, said the White Queen to Alice in Through the Looking Glass. A perfect description for the condition also known as transient global amnesia. There were 2 papers published in 1956, an American and a French one, describing the symptoms of TGA. It is thought to affect 3 to 8 in 100,000 people, predominantly in people over 50. I have to emphasize that it is transient, which means people will have episodes and then return to normal. The length of these episodes vary from person to person. However, different sources estimate between 4 to 6 hours and 24 hours. Alan Roper, in his 2023 paper, described the most prominent clinical features of TGA, including anterograde amnesia, which is the inability to form new memories, and retrograde amnesia, which is forgetting past events. He continues to say that during an episode of TGA, all other brain functions are normal. During an episode of anterograde amnesia, a person might ask the same questions over and over again. Where am I? What happened? Who are you? Every 30 seconds. During a retrograde episode, the length of time that one has forgotten could span minutes, weeks, days, even years. These episodes can be triggered in the most random of ways, from trauma, yeah, understandable. Medical procedures, yeah, medical trauma, gotcha. Showering in cold water, okay. In the literature I looked at, the causes of TGA aren't exactly known, but research is flirting with the idea that it could be caused by changes to the hippocampus, an area of the brain responsible for memories. In most of these papers, they made the same observation, little dotty spots of hyperactivity on the left side of the hippocampus. Unfortunately, due to the location and the nature of these changes, nothing can really be done at this point in time. Maybe there's a chance in the future that some sort of drug could tackle the hyperactivity. Who knows? I'm not a neuroscience, I'm a goth with a degree doing YouTube. This was a bitch to research. Most of the journal articles are from the 60s and 70s, and I hate using websites or government pages unless I am super pressed. I did find 2 very informative articles that were peer-reviewed by MDs, so that's where most of my information is going to come from. The papers I did find were very, very esoteric, talking about stuff that I don't even know about. Please do not make me talk about this. So I googled it and I started reading the article, and this image is probably one of the easier ones to follow. It was a really interesting read. The Little People of the World Organization and the Little People of America describe a little person as an adult standing at 4'10" or shorter, and children as being 97% shorter than the rest of the children at their age. Now let me set one thing straight. When I am talking about dwarfism, I am talking about the medical condition and nothing to do with the person with dwarfism. Little people are little people. I'm not a bigot. I have a septum piercing. That should be enough proof. The main types of dwarfism are disproportionate and proportionate dwarfism. Disproportional dwarfism comes with a larger head, legs bowing outwards, and very small limbs compared to their torso. Proportionate dwarfism is just as it sounds. Limbs, head, and torso are all proportional, just small. Unlike disproportional dwarfism, which is caused by genetics, proportional dwarfism is usually caused by a reduced level of human growth hormone, or HGH. Low HGH levels can impact bone formation and delay sexual development. The most prevalent form of dwarfism, sitting at 70% of cases, is achondroplasia, which presents in 1 in every 25 to 30,000 children. Spondyloepiphyseal dysplasia is less common, presenting in 1 in 95,000 children. I'm just gonna stop there before listing 400 fucking types of dwarfism. We ain't got time! Boy! This is gonna get graphic. Do not Google this one. Just don't. It's okay if you skip this one. I have an illustration, but no real pics. So it's coming up in 3, 2, 1. As I hinted, necrotizing fasciitis is a bacterial infection that decimates the soft tissue around it. Necro meaning death, fascia meaning the tissue that lies underneath the skin, and itis means inflammation. It's caused by bacteria entering an open wound. Okay, you can open your eyes now. Right, so it doesn't just fuck up the tissue. It can get into your bloodstream and cause sepsis. And it has a mortality rate of up to 60%. So aside from the gaping hole in your body and the dead black flesh around it, other symptoms of NF are as you would expect with sepsis. Fever, racing heart, low blood pressure, and way too many immune cells in your blood. In a 1997 study by Itzhak Brook and Edith Fraser, they swabbed the sites of 83 patients to see what bacteria they were working with. Out of the 375 bacterial colonies they grew, most of them were Streptococcus and Staphylococcus species, which are very common. They live on your skin. However, what interested me the most was the presence of Escherichia coli and other Enterobacteriaceae, which are bugs that are very common in your butt and gut. Imagine taking the most glorious poo and neglecting to wash your hands. You end up picking a scab on your arm or your leg, and boom, you could end up with necrotizing fasciitis. The only treatment for it is to get surgery, ASAP. A large study conducted in 2020 by Femke Nargin et al. Found that operating within 6 to 12 hours of presentation at a hospital improved mortality rates significantly. So this was a really interesting one that I've never come across actually. Piebaldism is an inherited condition which is caused by a genetic mutation. We'll talk more about that later. The telltale sign of Piebaldism is the white patch of hair in front of the forehead, present in up to 90% of affected people. Another characteristic is the presence of white skin patches on the body, sort of like vitiligo, except vitiligo is an autoimmune disease that develops over time. Speaking of genetics, let's talk about how Piebald happens. We have a gene called KIT. Now the KIT gene is one of many genes responsible for distributing melanocytes or pigment cells. That's how we get our different skin colors. During embryonic development, the KIT gene makes sure that the melanocytes are distributed all over the body evenly. So it makes sense if the gene is mutated that the melanocytes aren't going to be evenly distributed. Instructions unclear. Made patches. It's classed as an autosomal dominant gene. Autosomal means that it's present in every cell except for the sex cells, so ova and sperm. Dominant refers to how strong the gene comes through. In this case, only one parent needs to have Piebald's to pass it on. If one parent has it and the other doesn't, there's a 50-50 chance of passing on the mutated gene. There's nothing to suggest that Piebald's causes any other health problems, but there are social problems, because we all know how people like to punch down people that are different. In their 2015 paper, Alexander Grob and Stephen Grecken offered temporary treatments such as wearing makeup on the patches or buying sunless tanning solutions. In the more newer studies that I've found, there have been advancements in skin grafting for this particular issue. There are many different procedures for this, so I'm just going to talk about the 3 that kept coming up. Mini punch grafting, suction blister epidermal grafting, and cultured melanocyte grafting. IPG is considered a simple and cost-effective treatment. Multiple tissue samples are taken from hidden spots on the body, so areas not exposed to the sun, and grafted onto the white patches. 7 days later, the bandages are removed and the site is exposed to UV light to stimulate the melanocytes. It's considered highly effective, but scarring can occur if the punch is more than 1.5 millimeters. SBEG is also considered simple and cost-effective, but it works slightly differently. It's performed by creating blisters in the hidden areas of the skin and suctioned out. The white part is sterilized and exfoliated until it starts to bleed a little bit, which means that you're getting rid of the top layer of the skin and exposing the area where melanocytes are meant to grow. The skin from the blisters is placed on the area and bandaged. After 2 weeks, it's expected that the melanocytes from the blistered skin will transfer into the white patch. Throw in a few UV sashes and you're golden. Unlike the first two methods, CMG transfers cells, not tissues. Like usual, the tissue is taken from the patient, but instead treated with chemicals to strip away the layers of the skin. So what happens is that the top layer is stripped off, exposing the skin with the melanocytes in it. Next, the melanocytes are taken to a lab and grown in a petri dish until there's a huge number of them. Once the cells are ready, the white patch is either blistered or exfoliated until it starts to bleed, and then the cells are transferred. Just a heads up, this part could be potentially triggering and I want you to be safe. My views are not as important as your mental health. Skip to the next section or click off entirely if you want. Also, I am in no way qualified to speak on psychology. I am just following the research that I have read. The Diagnostic and Statistical Manual of Mental Disorders defines schizophrenia as such. I won't read all of it, but I'll summarize it as best as I can. The person needs to show 2 or more symptoms shown in this image. They need to have lasted at least 1 month and must have negative effect on at least 2 sections of their lives. These symptoms can overlap with schizoaffective disorder, which is not the same thing, or bipolar with psychosis. It all comes down to whether or not the symptoms from the other conditions match up with it. For example, I have bipolar disorder with psychosis, but the reason that I'm not schizophrenic is because I show more symptoms than I do schizophrenia. The reason I was diagnosed with bipolar with psychosis instead of schizophrenia, even though I have some of the symptoms, is because my personal situation fits the bipolar criteria better. No, I will not elaborate. Delusions are very strong thoughts that you are convinced are true. This could be paranoid delusions of people following you, or grandiose delusions where you're convinced you're going to join an MMA dojo and become a UFC fighter and start doing interviews on late night talk shows. Oh, just me? Hallucinations are easily defined as sensing something that just isn't there. They can be visual, auditory, you can smell things. They can be very distressing, or sometimes it could be a cat wearing a top hat and tipping its hat to you as it saunters into a bush. I don't know if I should be talking about this. Disorganized speech is when it's difficult to get a train of thought out in a clear way. You could be running on very wild tangents or speaking incoherently or even repeating yourself over and over. Disorganized behavior can come as unpredictable and erratic behavior. Catatonia can be anywhere between really sluggish and slow to being really heightened, so really agitated or really excited. Finally, negative symptoms encompass a lot of things. Lack of motivation, socially withdrawing, and total anhedonia, so no pleasure or happiness. If you're experiencing any of these symptoms and they're causing you distress, I really recommend going to see help before it gets worse. So great, we know what it is, but how does it happen? We're not sure. But 2 papers in 2022 by Toshiaki Onizuka et al. And Laura Orsolini et al. Offers the theories that it could be a combination between environmental factors and genetics. Such factors that they mention include childhood trauma, maternal infection, and malnutrition either in utero or in infancy. I won't talk about treatments because that's a huge rabbit hole. Instead, I want to talk about one of the main abnormalities found in the brains of people with schizophrenia. There are two types of brain tissue: grey, the outer layer, and white, the inner layer. Schizophrenic brains are found to have less grey matter in the areas responsible for memory and sound processing. The white matter of the brain is also affected, leading to reduced cognitive processing speed, and is also linked to less effective treatment. The human immunodeficiency virus attacks a person's immune system by specifically targeting the cells responsible for the defense maintenance. Progressively, the number of these cells decrease, and there is an increased risk of opportunistic infections, so other like bacteria and viruses coming in to take advantage of the weakened immune system, and other cancers. If it's not treated, it will lead to the development of acquired immunodeficiency syndrome, or AIDS. As of 2024, the World Health Organization identified 40.8 million people still living with HIV. AIDS was recognized as a brand new disease by the CDC in 1981. They noticed an increase in pneumonia and Kaposi sarcoma in gay men, which were later identified to be the first cases of AIDS. So how does the virus replicate? Don't look too deeply into this diagram. I'll explain the most important parts. The RNA of the virus slides into the DMs, or rather PM, of the body cell. It kind of hangs around the area of the cell with all the DNA in it, borrows some chemicals from within the cell to turn it into DNA. It then slides into a section of the human DNA and creates millions of copies of itself. Once it's used and abused the cell, it gives one final insult by stealing some of the cell's membrane to cover itself and scoot along to another cell to do the same thing all over again. So how do we catch it? The WHO identifies the main causes of HIV transmission: sexual activity involving semen and or vaginal fluid, so it is possible to transmit between men and women. Men are more likely to transmit to women than the other way around. It can also be passed in breast milk, so HIV positive mothers can transmit it to their babies. And in blood. So not only are IV drug users at risk, but also everyone that works in healthcare that is exposed to blood. Like me, as a phlebotomist. I looked at a recent paper from 2023 by Landowitz et al. Looking at preventative measures and treatments. There is no cure for HIV. So in my humble opinion, continuously developing preventative measures is really important. In terms of pre-exposure prophylaxis, there are oral tablets as well as a brand new vaccine that's just been approved by the FDA a couple of months ago. It's called Yes2Go and the drug name is lenacapavir. In terms of treatment, antiretroviral treatments have been the most impactful. Undetectable equals untransmissible is a public health message aiming to destigmatize people living with undetectable HIV as well as promoting current treatments. Alright, one more fun fact before we move on to the next topic. Did you know that there is a genetic mutation that can highly increase your defense against getting HIV? The mutation is called delta 32 CCR5. Alison Galvani and John Novembre described the effects of the mutation in their 2005 paper. If you have 2 copies of the mutated gene, HIV is much less likely to attack those cells. If you only have 1 copy, you can still get HIV, but the progression from HIV to AIDS is much slower. Why is this a fun fact? Why did I need to include this? Because I found out during a genetic study at uni that I have a copy of delta 32 CCR5, and I thought it was really awesome. Alright, we're getting there. We're getting there, fellas. We're getting there. Right, I know it says dogs on the iceberg, but we're going to focus on humans because that's what I do best. Dirofilariasis is a zoonotic infestation caused by various species of the Dirofilarius worm. These parasitic roundworms often affect small mammals such as dogs, cats, foxes, raccoons. It goes on. It's passed on by mosquitoes taking blood meals. but we'll talk about that in a bit. Let's talk about the life cycle of the Dirofilariasis. It starts with the mosquito taking blood and ingesting what's called microfilariae. The eggs grow inside the mosquito until it develops into a worm. The mosquito takes a bite out of the human, dog, raccoon, whatever, and the worms enter the open wound. The adult worms live in the tissue and produce more microfilariae that swim in the blood. In humans, it's most commonly found under the skin, in the lungs, and it grows in people's eyeballs. I've censored it because, Jesus Christ, it's grim. Google at your own risk. Other sites are discussed in Marietta Reddy's 2013 paper, which include male genitalia, thighs, upper arms, and more. So among the sources I looked at, this can basically occur anywhere. Of course, it's more likely in tropical areas because it's nice and warm and mozzies love that. But I found the most peculiar thing. A 2007 paper by Laura Kramer et al. Described 14 cases of it in Russia. It's fucking cold there. Why would there be mozzies? What? Can anyone in Russia or any really cold areas sound off in the comments? Because I'm bewildered. Symptoms of Dirofilariasis depends on where they are. If they're in the lungs, people usually cough up blood, have a fever and chest pains, and it's usually diagnosed through x-ray. If they're under the skin, then signs of inflammation will be present. And in the eyes, you can see them. You can see the little buggers wriggling around in the sclera. The latter two are diagnosed by biopsy and visual confirmation respectively. To remove the eye-dwelling worms, injections of lidocaine and epinephrine are administered. Then, the removal. Tweezers and a steady hand. For worms that are living under the skin, an antihelminthic and an antibiotic is administered. Surgery isn't recommended for risk of surgical complications. Lastly, in terms of lung infestations, the way to go is video-assisted thoracoscopic surgery, or VATS. It's considered less invasive than open surgery and is associated with better surgical outcomes. According to Elizabeth Joseph et al., the highest risk factor is physically being in an area with mosquitoes. So how do we get the mosquitoes? How do they thrive? Basically, their perfect summer getaway is being in a warm climate around even little puddles of water, especially in breeding season. All of this is a horrible cocktail for developing Dirofilariasis. Ring around a rosy, a pocket full of posy. Achoo, achoo, we all fall down. The bubonic plague, also known as the Black Death, is a zoonotic bacterial infection. It's estimated that the wide spread of the Black Death was that it was carried along the Silk Road Trail all throughout Europe, Northern Africa, and the Middle East. It is estimated that 15 million Europeans had died from the plague. Unfortunately, the WHO says that it is still prevalent in the Democratic Republic of Congo, Peru, and in Madagascar. There are only about 2,000 cases with a mortality rate of 30 to 60%. The causative agent of the bubonic plague is a bacterium called Yersinia pestis, which is also responsible for the septicemic plague and the pneumonic plague. Rats infected by the bacterium are bitten by fleas, who then also become infected. The infected flea then bites the human. The bacterium travels to the lymph nodes and creates millions of copies of itself. The swelling of these lymph nodes, called buboes, eventually burst into open, pussy sores and cause extreme pain. You can also contract the disease by touching the pus, as pus is the body's way of getting rid of the germs through open wounds. Additionally, the tips of the fingers begin to go necrotic, called acral gangrene. Diagnosing plague involves taking a fluid sample from the bubo and analysing it in a laboratory. Because it takes some time to do this, antibiotic treatment is started straight away. The antibiotics such as gentamicin and ciprofloxacin are started through an IV drip, and this course can continue for several weeks.
Oh, shit!
Hi friends, Editing Courtney here. I forgot to film an outro. So thank you if you made it this far. I'm really looking forward to doing part 2. It's gonna be insane. It's big. So I'm gonna have to cut that into parts as well. Anyway, if you did like what you see, hit like and subscribe to see some more. Alright, catch you in the next part. Bye friends!